CIT grant and the co-response grant has completely changed the culture of our police department.
The impact for the jail diversion program grant for me, I know I've become a better police officer when I'm out in my community.
We looked at both CIT and co-response, and we saw tremendous benefits to both. So once we decided that that's what we were looking for, DMH became instrumental in that process.
We have reduced our use of force. We have increased the ability for our officers to de-escalate situations. We're working hand in hand with clinicians. The clinicians are actually in our cruisers, and we're bringing mental health to the person rather than bringing the person to mental health.
Many times with them, we're able to either have them maintain in the home safely or go to respite and have more of a short-term stay rather than bringing them to the hospital and increasing their anxiety over that situation.
I think since I've been here for a lengthy period of time, I've been able to get to know not only the individuals who live in the community, but a lot of the community providers as well.
There's been days where outside, our clinician's sitting on the bench and there's one of her clients very animated, loud, sometimes yelling, and she knows when that's, when to rein that in and when to someone might just need to let that out, and also when they need to be connected.
Once the officers got to realize the benefits associated with dealing with jail diversion and people with mental illness and drug dependency, and having experts on hand, it made their jobs that much easier.
In my office, I have cards all over the place from people that just say thank you, and I'm not doing anything different than any of you would do.
This 40-hour CIT training is an integral part of officer training, especially when they come out of the academy. So what this training provides is an enhancement to the foundation that they were given at the academy. It makes them expand out their knowledge and to look at different calls for service different ways. Are we dealing with somebody who's on the autism spectrum disorder? And what did I specifically learn about people who are on the autism spectrum disorder?
We have an officer who responded to a call for a teenage boy who was acting aggressively on the street towards his mom. As soon as the officer got there, he recognized that this was a child who had autism. Through the CIT training, he was able to pick up on some of the signs, and he did a really wonderful job connecting with the family, and then actually has stayed connected with the family since then. He's gone to some other calls for that child, and the child calms down immediately as soon as he sees this particular officer, to the point where now he'll actually go visit the officer when he's kind of just on his route around town.
I know I think about a lot more than why am I just there at that moment. I think a lot more about what's going on with this family, what's happened to this family in the past, what's happened to this person in the past, recognizing that there's probably a trauma history.
We started small as more and more officers were trained, and we did notice that the training was having an impact on the way they were relating to people in the community, the way that they were responding to calls, particularly the way that they were taking their time and really starting to listen more to people and what they were saying that they needed. We decided that this was something, a form of training that we really wanted to make accessible to our entire department.
When I first started in this role almost 2 years ago, there was definitely some resistance, which is understandable. I'm an outsider coming into their station, which is a lot for any officer to be okay with and accept. So it started out as a running joke that I got a candy bowl for the office to coax them in and have them talk to me. And it ended up not needing to happen anyways because they were willing to take me in. But through that, I work with a lot of officers who just kind of talk to me about their day, and if they're having a hard time, I'm able to communicate with them on what could be helpful or where they should look for help.
20 years ago, I couldn't have imagined a clinician working in our police department, but now I couldn't imagine the department without one.